Now let's move on to the gram-positive bacillus that are non-endospore formers. Now there's one regularly shaped bacillus that's a non-endospore former, and that is Listeria monocytogenes. So Listeria is the only gram-positive non-endospore forming regular rod-shaped bacteria. Now what's key about Listeria is that it is very resistant to cold, heat, salt, extreme pHs, etc. So what makes this guy so interesting is that a lot of times during food production, they will add a lot of salt and they will add a lot of acids to food. So if you look at things like salad dressing or deli meats or things like that, they put a ton of salt and acid in there to try to kill off any bacteria. But Listeria actually thrives in these environments. In addition, putting your food in the fridge doesn't necessarily kill Listeria. So the way that this organism spreads to humans is through ingestion. And one place we see a lot of it is in deli meats. So every so often you hear about these outbreaks of Listeria in certain packaged meats. Now what makes Listeria so dangerous is that it actually will hide inside of phagocytes. So phagocytes don't necessarily kill the bacteria, and then the bacteria can grow in the phagocyte and it can transfer from one cell to another, so it can really evade the immune system. For somebody who is healthy, Listeria is usually not a very big deal. It's like a mild or maybe a subclinical, like no signs or symptoms at all, but there may just be a little case of food poisoning and it's not a big deal. Where Listeria is a big deal is in immunocompromised individuals, because Listeria can hide inside of cells and it can spread from cell to cell. It actually has this unique ability to cross the blood-brain barrier, so it can cause meningitis. It also can cross the placental barrier, so it's very dangerous for the fetus. So that's one of the reasons they tell pregnant women to avoid eating deli meats, is because of this high risk of transfer across the placental barrier. And it can actually lead to severe disease in fetuses, neonates, immunocompromised people. It can lead to meningitis. And it has a 20% death rate in these immunocompromised individuals. There are also many gram-positive pathogens that are technically considered bacillus shape, but if you look at them under the microscope, they appear more pleomorphic. So we're going to talk most about Corynebacterium and Mycobacterium, but there's also something called Propionibacterium. Propionibacterium usually causes acne. So Corynebacterium diphtheria, this is actually more like a very pleomorphic organism. It actually makes sometimes like a Y shape when it grows, or there may be like some long rods, some short rods. Okay, so that's what it looks like. Now, diphtheria is the disease that Corynebacterium diphtheria causes, and we don't see a lot of diphtheria anymore because we have that DTaP vaccine, and the D prevents against diphtheria. But where we might see diphtheria still is in areas where there's low vaccination rates, very unsanitary conditions. Diphtheria spreads easily via respiratory droplets. The key sign of diphtheria is something called a pseudomembrane. The pseudomembrane, it's almost like a film of bacteria that gets stuck on the roof of the mouth, and it's very difficult to remove. Actually, you should not remove the pseudomembrane, because if you try to remove it, then it will cause bleeding because it's stuck very deeply onto the mouth. And also it could lead to asphyxiation if it gets trapped in the respiratory airway and the person can't breathe anymore. So this would be the main sign of a localized diphtheria infection. Occasionally, if diphtheria enters into skin, it can also cause a cutaneous infection. The most serious type of diphtheria is if the bacteria gets into the bloodstream. It actually releases the diphtheria toxin, and it can lead to a toxemia that can lead to permanent nerve damage as well as cardiovascular damage. So diphtheria is one of those very deadly pathogens. Luckily, we do have the vaccine to prevent it. And lastly, I briefly want to talk about the Mycobacterium. We've talked about them before. We know that these are bacteria that have a very waxy cell wall, so they are considered acid-fast. Even though they're technically gram-positive, their cell wall doesn't stain properly with the gram stain, so we have to use that acid-fast. So that mycolic acid, which it makes their cell wall waxy, is the main virulence factor. The other main virulence factor is that Mycobacterium actually grow inside phagocytes in the lungs. So they grow in phagocytes, replicate there, and primarily in the lungs. Now, most people, if they do get tuberculosis, they get primary tuberculosis, like an initial infection. And actually, almost everybody has probably been exposed to tuberculosis at some point, but usually it's very subclinical, and most people don't even know that they've had it. The immune system takes care of it. Now, sometimes what can happen if it's really bad is, this is a picture of a alveolar macrophage. You can see the Mycobacterium in there. Sometimes what happens is macrophages, which are these blue cells, are going to surround the infected cells here, and they're going to create what's called a granuloma. So granulomas are really good at preventing the Mycobacterium from spreading outside of this infected cell. They help wall it off. But at the same time, granulomas can cause these permanent calcification sites in the lungs. So too many of these can actually be damaging to the lungs. And this would happen in like a severe infection. Sometimes the Mycobacterium can reactivate inside of this cell. So even though it's right now blocked off, it can reactivate and lead to a secondary tuberculosis. This is a more dangerous form of the disease because now there's something wrong. The immune system is no longer effective at preventing this outbreak. Occasionally, the tuberculosis could leave the lungs, become extrapulmonary, and it becomes systemic. And this is definitely the most dangerous form of TB. If TB spreads outside of the lungs, it can be extremely deadly. Problem with tuberculosis, number one, we know it's acid-fast. So a lot of traditional antibiotics that we would use for gram-positive bacteria won't work. So we have to use very specific drugs to kill off the acid-fast bacteria. The other issue is tuberculosis is a very slow-growing organism, and it's hiding inside of cells. So usually if someone gets treatment for tuberculosis, they're on these medications, these antibiotics for months and months and months to ensure that we've killed off all of these actively growing Mycobacterium in the body. The other Mycobacterium is Mycobacterium leprae, which causes the disease leprosy. So leprosy is an infection that infects skin and other tissues. And as you probably have heard about leprosy before, like in history books, it's not very common today, especially in more developed countries. We usually only see this in the lesser developed countries. And also leprosy is extraordinarily slow growing organism. So it could take years before we see any signs or symptoms of leprosy. And also because it's so slow growing, similar to tuberculosis, treatment is long-term, months or even years of antibiotic therapy to cure the infection.